Hello, my name is Phil Pereira, and I'm the Emergency Ultrasound Coordinator at the New York Presbyterian Hospital in New York City. And welcome to Soundbites Cases. In this Soundbites module, entitled Part 1 of Bedside Ultrasound of the Aorta, we're going to specifically look at the bedside detection of abdominal aortic aneurysms. Now, this application of point-of-care bedside sonography is one of the most crucial ones for the emergency physician, as detection of an abdominal aortic aneurysm can be life-saving for your patient at the bedside. Using point-of-care sonography to make the rapid diagnosis of a rupturing abdominal aortic aneurysm in a patient who has unstable vital signs can facilitate timely transfer of the patient to the operating theater without undue delay in the emergency department, such as waiting for a CAT scan. As there's a lot of material to cover on the topic of bedside ultrasound of the aorta, I've divided this module into aorta ultrasounds parts 1 and 2. In this module, entitled Aorta Ultrasound Part 1, we're going to begin by reviewing the anatomy of the aorta. We'll then move on to learn how to perform the ultrasound examination of the abdominal aorta, all the way from the top at the subxiphoid process as the aorta exits the thoracic cavity to bifurcation at the level of the umbilicus. We'll then also move on to learn how to understand the interpretation of the ultrasound images that you will obtain using bedside sonography. Let's review the positions of the probe for sonography of the aorta. Generally, we'll begin by placing the probe in a short axis configuration. Begin by placing the probe in probe position 1 in the epigastric region to visualize the aorta as it enters the abdominal cavity and exits through the thoracic cavity via the diaphragm. The probe should be configured with the marker dot over towards the patient's right side. Press down to firmly displace bowel gas and get a glimpse of that aorta. Now we should visualize the spine as our landmark, and on top of the spine we'll visualize the aorta. Then we should slide the probe inferiorly to probe position 2 here as shown in the supraumbilical region. This will allow us to visualize the entire part of the abdominal aorta all the way down to bifurcation. We should complete the examination of the aorta by looking at the aorta in a long axis plane. We'll begin by placing the probe in probe position 1, again in that epigastric region to visualize the top part of the abdominal aorta, have the marker dot superiorly oriented towards the patient's head. We can then slide the probe inferiorly to probe position 2 at the region just above the umbilicus to visualize the aorta all the way down to bifurcation into the paired iliacs. Now, if we're having problems visualizing the aorta due to the presence of a lot of bowel gas, we can also get a glimpse of the aorta from probe position 3, the right hepatic window area. This is going to be about the region where we're going to look at the trauma fast right upper quadrant view, but here we're going to angle the probe more anterior over the kidney to get a glimpse of the abdominal aorta in long axis. Here's an image showing the anatomy of the aorta that we'll need to know to perform bedside sonography of this structure. Recall that the inferior vena cava and aorta form two paired tubular structures that course through the abdominal compartment. The IVC will be towards the patient's right, and the aorta will be over towards the patient's left side. We see here the first major abdominal branch of the aorta, which is the celiac axis, made up predominantly of the hepatic artery and the splenic artery. The third branch, the left gastric artery, is not well seen on bedside sonography. The next major branch that we can see using bedside sonography is the superior mesenteric artery. And this is a very important landmark as the renal artery and vein come off the aorta at about this level. In fact, the left renal vein courses right below the superior mesenteric artery. We need to pay particular attention to the infrarenal part of the aorta, as this is where the majority of abdominal aortic aneurysms will originate. Now we need to scan all the way down to the bifurcation of the aorta into the paired iliac arteries, and sometimes we'll catch small aneurysms at the distal aspect of the aorta that branch into the iliac artery. This is a short axis configuration taken of the abdominal aorta just below the subxiphoid process of the sternum, looking through the liver. Now our first landmark should be the spine, and notice that it has a hyperechoic or bright appearance on bedside ultrasound. Just above the spine, we see the inferior vena cava with its respiratory phasic pulsations towards the patient's right, and the aorta towards the patient's left side. We can apply Doppler sonography to further differentiate the two structures. And notice here we're doing color flow Doppler, and we again recognize the spine as our landmark for recognizing the vascular structures of the IVC and aorta on top of the spine. And we see the phasic respiratory pattern of blood flow within the IVC and the steady pulsations of blood within the aorta with each heartbeat differentiating the two structures. Let's now take a closer look at the celiac axis, the first major branch of the abdominal aorta. The celiac axis has the ultrasound appearance of a seagull sign, and it's made up of three arteries: the hepatic artery, the splenic artery, and the left gastric artery, although the third is usually not visualized well with bedside sonography. Now let's take a look at some ultrasound images of the celiac axis, and we see a B mode or grayscale image to the upper right. Notice the IVC to the right and the aorta to the left. And we see the celiac axis coming off the aorta having the appearance of a seagull in flight. Notice that the right wing of the seagull will be the hepatic artery coursing towards the patient's right side, and the splenic artery will be branching over towards the patient's left. To the bottom, we see a color flow Doppler image of the celiac axis showing flow within both the hepatic and splenic arteries. Here's a video clip of the celiac axis in action. Again, we're in a short axis configuration with the probe marker over towards the patient's right side. We identify the spine as our landmark for identification of the IVC and aorta anterior to the spine, and we see here the bright bone table of the spine. Notice the inferior vena cava towards the patient's right side, and we see the aorta towards the patient's left side, with the seagull sign made up of the celiac axis coming off the aorta. Here we have a video clip in which we'll look at the ultrasonic appearance of the celiac axis using Doppler sonography. We again identify the spine by its hyperechoic or bright appearance, and we see the IVC over towards the patient's right and the aorta towards the patient's left. As we look closely at the aorta, we see the branch, the celiac axis, coming off anteriorly from the aorta, again having that classic appearance of the seagull sign with the two branches, the hepatic and splenic arteries. The second major branch of the abdominal aorta is the superior mesenteric artery, also known as the SMA. Now, the superior mesenteric artery has a classic appearance as it has a bright or hyperechoic rim due to fat wrapped around the artery. Remember that it's at this level that the renal artery and veins come off, the IVC and aorta, and we must be very aware of the aorta at this area because of the presence of infrarenal aortic aneurysms. We see a B mode or grayscale image over to the right, and we see the IVC and aorta on top of the spine. Notice the classic appearance of the superior mesenteric artery as it arches off the aorta with its hyperechoic or bright rim. Here we actually catch the splenic vein passing anterior to the superior mesenteric artery. To the bottom, we see a color flow Doppler image showing the superior mesenteric artery coming off of the aorta. This video clip shows the proximal abdominal aorta in short axis. We identify the spine and the aorta on top of the spine. There's the celiac axis coming off, and there's the superior mesenteric artery with a splenic vein over the top. So again, celiac, and there's SMA, and there's the splenic vein wrapped on top. So let's freeze down that image and again identify the superior mesenteric artery with its bright or hyperechoic rim and the splenic vein passing anterior to the SMA. Here we'll apply color flow Doppler to further examine the superior mesenteric artery coming off the aorta. We identify the aorta on top of the spine, and we can see the superior mesenteric artery coming off anterior from the aorta. Notice we can also catch the splenic vein wrapped on top of the superior mesenteric artery. So we'll go ahead and freeze that down. There's aorta towards the back of the image, the superior mesenteric artery anterior to the aorta, and the splenic vein arching on top of SMA. To complete your examination of the aorta, it's important to look all the way to bifurcation. Here we identify the spine, and on top of that, the distal aorta in short axis. As we scan more distally, down to the level of the umbilicus, here we see the bifurcation of the iliac arteries. So we'll watch that again, and there we see bifurcation right at that point here. And there's the paired iliac arteries, and we can see the right and left iliac arteries delineated well on B-mode imaging. Now we'll apply color flow Doppler to look at the bifurcation of the aorta. Again, we're in the short axis configuration, and we see the spine, IVC to the right, and aorta to the left. Let's put this into video play now, and what we see here is the pulsations of flow within the IVC and aorta, and we can see the aorta branching right there into the paired iliac arteries. Notice the pulsations within both of the paired iliac arteries. We'll still that down, and we can see the right and the left iliac arteries well delineated with the color flow Doppler. It's always important to look at body structures in two planes, so now we're going to inspect the aorta in a long axis view. The probe is placed in a mid-sagittal orientation with a marker towards the patient's head, so we have superior to the left and inferior to the right. We can identify the aorta with its pulsations and its thick muscular wall. We see the branches of the aorta, the celiac axis branching more superiorly, and the superior mesenteric artery arching inferiorly into the intestine. We can apply color flow Doppler to the aorta in long axis view, and again we can see the pulsations of the aorta with each heartbeat. We see the liver anteriorly in a mid-sagittal configuration, and notice the celiac axis arching here superiorly and the superior mesenteric artery moving inferiorly down towards the intestine. In conclusion, thanks for joining me for the Soundbites module covering part 1 of bedside ultrasound of the aorta. Using bedside ultrasound to detect an abdominal aortic aneurysms remains one of the most crucial applications of point-of-care sonography for the emergency physician. And hopefully by going through this module, you now understand the anatomy of the abdominal aorta, how to perform the ultrasound exam of this structure, and how to interpret the images of the aorta that you will obtain. So I hope to see you back as Soundbites continues and as we return in bedside ultrasound of the aorta part 2, when we're going to focus entirely on the detection of abdominal aortic aneurysms.